Language disorder means having trouble in understanding others and expressing herself. Aphasia due to brain dysfunction. A person with aphasia faces following problems: comprehension, speaking, reading, and writing. It is caused by head injury, infection, stroke, or tumor of brain. Aphasia is a total disruption of understanding the speech or producing speech. There are four types of aphasia: expressive aphasia, damage to broca area which affects speech productions; receptive aphasia, damage to wrinkle R which affects speech understanding; global aphasia, combination of both expressive and receptive aphasia; anomic aphasia, problem in recalling words, names of numbers; dysphasia is moderate disruption in comprehension, speaking, reading, or writing; expressive language disorder in producing the language. It means a child has difficult conversing information in speech, writing, sign language, or gesture. The child may not use correct grammar, may produce very short phrases and sentences, and may have a small vocabulary. Receptive language disorders. It means a child has difficulty getting information in listening and reading. The child may not understand the spoken words and have trouble in reading. Child has trouble in understanding speech, following directions and discriminating similar sounds. Child often asks repetition of clarification. Auditory processing disorder. A child with APD can't process the information he hears because his ear and brain don't fully coordinate. Child hears the sound but his brain not interrupt it correctly. Children with APD may exhibit a variety of listening and related complaints, i.e., difficulty in understanding speech in noisy environments, following distinction and discriminating similar sounding speech sounds. Sometimes they may have as if a hearing loss is present, often asking for repetition or clarification. Causes of speech language. It may include following: hearing loss, vocal cords damage, vocal cords paralysis, brain damage, muscle weakness, respiratory weakness, ADHD, oral cancer, developmental disorder, genetic syndromes, and neurological disorders. Diagnosis of speech. Speech therapist, with the help of different tests, diagnoses the speech of language disorder. Following can be used for the diagnosis: Denver Articulation Screening Exam. It is not commonly used test to diagnose speech disorder. It evaluates clarity in pronunciation in children of age 2 7 years. It is 5-minute test, uses various exercise to assess speech. Early language Melton's scale. It determines child's language development. This test and quickly identify delayed speech or language disorders.